Hello, welcome to our channel. In this video, I'm going to discuss all the MCQs that are related to aspirin. Important MCQ which is repeatedly asked in MCQ exam is about the aspirin overdose. Aspirin overdose causes you have to select alkalosis, although the effect or the causes what aspirin causes can be remembered by the mnemonic TRMCD. T is for tinnitus, R is for respiratory alkalosis, M is for metabolic acidosis, C is for coma, and D is for death. If both coma and alkalosis are in option, you have to prefer alkalosis, as first alkalosis occurs, then coma occurs. And you have to remember that it initially causes respiratory alkalosis, then metabolic acidosis, and then coma. For aspirin mechanism of action, you need to remember that it is an irreversible inhibitor of COX-1 and COX-2, where reversible inhibitor is diclofenac and other NSAIDs, but aspirin is an irreversible inhibitor and it also inhibits thromboxane A2. So the mechanism of aspirin to decrease fever is by irreversible inhibition of COX-1 and COX-2, as it decreases the prostaglandin, so it's going to decrease fever. Aspirin also inhibits thromboxane A2 and it irreversibly inhibits the function of platelets by inhibiting thromboxane A2. It also inhibits the thrombus formation and inhibits platelet aggregation. Genesis for long-term aspirin therapy is inhibition of thromboxane A2. The mechanism of action of aspirin in myocardial infarction is the inhibition of thromboxane A2. Low-dose aspirin prophylactically given in chronic artery disease patient. The mechanism of action is thromboxane inhibitors. These all are the MCQs which are asked in the paper. So which NSAID is contraindicated in chronic liver disease? The answer is going to be aspirin. Aspirin and other NSAIDs are the best avoided in chronic liver disease patient because of the risk of renal impairment, hepatorenal syndrome, and GIT hemorrhage, whereas paracetamol is a safe drug in patient with chronic liver disease, but a reduced dose of 2 to 3 grams per deciliter is recommended for long-term use. Other important thing you need to remember of aspirin is that it has to be stopped 1 week before surgery, as A is the first letter of alphabet, so you need to remember first, that is 1 week before surgery. How many days effect of aspirin remains is almost about 1 week, so 7 to 9 days. The drugs which you need to remember is a lithium. Lithium must be stopped 2 weeks before surgery. Remember, L is formed by 2 straight lines. Monoamine oxidase inhibitors must be stopped 3 weeks before surgery. That is, can be remembered as MAO has 3 letters. Estrogen pills stopped 4 weeks before surgery. Remember, E is formed by 4 straight lines. You need to remember that the most selective COX-2 inhibitor is celecoxib and more potent COX-2 inhibitor is meloxicam. And reversible and irreversible inhibitors, reversible inhibitor is diclofenac and irreversible inhibitor of both COX-1 and COX-2 is aspirin. So this was all about this video. Thank you for watching.